Trent called me feeling overwhelmed, frustrated, exhausted by his compulsive rumination. He had GAD, generalized anxiety, and OCD, and he was struggling with rumination about false memories that made him anxious and uncomfortable. Trent especially struggled when he tried to get to sleep because he felt like he couldn't stop the intrusive thoughts or the rumination. Have you gotten caught up in rumination? Hi, I'm Paige, a psychotherapist specializing in anxiety disorders and OCD. Welcome to Therapy for a Better Life. Maybe you caught yourself ruminating about your health or physical sensations or something that happened, or perhaps you had an unwanted, intrusive OCD thought. Rumination is repetitive, unproductive, analytical thinking. If you suffer from GAD, generalized anxiety, you may find yourself ruminating on lots of different worries. It likely feels like it happens automatically, but it's a conscious behavior that has developed into a bad habit. And if you have OCD, your rumination likely reinforces your particular OCD theme or intrusive thought that you're experiencing at the moment. Trent, for example, was ruminating on whether or not a false memory had actually happened. He kept reviewing his memory in his attempt to get clarity that something terrible didn't happen. Unfortunately, even though he was trying to feel better by ruminating, Trent was stuck in a mental compulsion. He was creating a bad habit that reinforced his anxiety and his OCD. Rumination is probably the most common compulsion that feeds the anxiety and OCD cycles, especially for people that have OCD with mental compulsions instead of physical compulsions. You may not have been trying to ruminate, but it happened and unfortunately developed into an unconscious habit. You might have wondered about the difference between an intrusive thought and rumination. An intrusive thought is an unwanted thought that feels uncomfortable, scary, gets obsessive, and sometimes it's even terrifying. It makes you doubt what you've always known to be true about yourself. In comparison, rumination is a mental activity that is in response to your unwanted thoughts and feelings. Rumination can become compulsive when you attempt to go down that black hole of figuring something out to make yourself feel less anxious. So the first step in stopping rumination is recognizing when you're doing it. When you notice yourself in the act of ruminating, label it. Call yourself out. Say, I'm ruminating. Then give yourself permission and a directive to stop. Several ERP techniques are effective in stopping rumination. I recommend my I Am method, and I'll leave you a link to a video called Brain Hack for Anxiety and OCD where I describe that technique in detail. I also made a video on rumination in the past where I discussed Michael Greenberg's writings about how rumination is the same kind of problem-solving brain activity we use when we try to solve a math problem or plan a party. You can practice stopping rumination by using a different problem to solve. For example, try to solve a math problem or what to make for dinner, and then stop solving it. It sounds so easy when you describe it like that, but when something becomes a compulsive habit, of course, it's not as easy to stop. We develop these habits over time, but you can also break the habits. Some complications to stopping rumination include what to do if you're trying to get to sleep and your brain is ruminating. So ask yourself if your rumination is about a solvable problem or is it an OCD intrusive thought, like in Trent's case. If it's a solvable problem, something like something you need to take care of tomorrow, write it down on a piece of paper next to your bed just to let your brain know, yes, you've got it. And if it's an OCD intrusive thought that decided to show up when you're exhausted and trying to get to sleep, I recommend being as non-reactive as possible. Trent preferred using kind of a watered down version of my I Am technique at night. Just allow the thought to float there unattended, whether it's a thought, a sensation, a feeling. Notice it, identify it, but you're not attending to it or responding to it or ruminating or checking on it. Frustration and feeling overwhelmed only makes it worse. Stay as non-reactive as you can, again, without checking on it, and it will get much better with practice. Now, there's no perfection here. Thank your brain and leave it floating there while you try the best you can to fall asleep. If you need more help on OCD or health anxiety, I left you a free ERP PDF in the description below. And check out this video here, Brain Hack for Anxiety and OCD. This will really help you. Until next time, I'll see you in session. Take care. Bye-bye.